So there was once a guy who went to his local general practitioner, and the doctor told him, "Listen, man, I'm afraid I have good news and I have bad news for you. Which would you like to hear first?" So the guy, being a natural optimist, said, "You know what, doc, keep me with the good news first." The doctor said, "Unfortunately, sir, I have to tell you, you have just 24 hours left to live." The guy was surprised and shocked. He said, "What? That's the good news? What could possibly be worse than that? What's the bad news?" The doctor said, I was supposed to tell you yesterday. Sorry. Good morning. Thank you once more for joining me. It's Dr. Ryan here. We are embarking on a new algorithm today. Thank you to everybody who's been liking and sharing my videos. We're stepping away from the discipline of nephrology. We're going to be discussing some topics in general medicine now, some stuff that we observe quite commonly on the wards. The first of these is going to be delirium. Now, delirium is a clinical diagnosis caused by one or more underlying medical conditions characterized by a disturbance in attention and awareness along with additional disturbances in cognition. Additional features of delirium include fluctuating disturbances involving perception, the sleep-wake cycle, psychomotor activity, emotional control, and behavior regulation. Risk factors for delirium include older age, dementia, cognitive impairment, history of delirium, functional impairment, sensory impairment, history of stroke, alcohol abuse, and depression. The causes of delirium can be separated into the following categories. We speak to neurological, where we're going to discuss 8 causes. Toxic, there's 4. Metabolic, there's 11. Infectious is 6, and others as well. History and physical exam are fundamental to determining the causes of delirium. Neuroimaging, lumbar puncture, and EEG, the electroencephalogram, can be helpful in some cases. Treatment for delirium hinges on the identification and reversal of the underlying medical condition. Other basic tenets of treating delirium include minimizing centrally acting medications like narcotics, maximizing the presence of family, avoiding sleep-wake disturbances, adequately treating pain, and maintaining a quiet environment. Pharmacological treatment like antipsychotics should be considered in patients with severe agitation who exhibit behavior that may be harmful to themselves or others, or in those with distressing psychotic symptoms. Let's get started. So on the left-hand side, we said neurological causes of delirium, of course, can be cerebral hypoxia, seizure activity, traumatic brain injury, intracranial hemorrhage, an intracranial lesion like a brain tumor, hydrocephalus, CNS vasculitis, and immune-mediated encephalitis. And many of these causes I'm sure you're familiar with from our previous algorithms in neurology. Toxic causes, medications can cause it, yes indeed. Alcohol, both intoxication and withdrawal can cause it. And what also comes to mind is Wernicke-Korsakoff syndrome, right? Recreational drugs, especially the hallucinogens, and a variety of poisons as well. Metabolic issues, now this is huge, right? Because this is largely something that we can do something about. Many of these are reversible. Hepatic encephalopathy, uremia, hypoglycemia is very important to pick up. Hyperosmolality, electrolyte disturbances in the way of sodium, potassium, notably, even calcium as well, hypercalcemia, vitamin deficiencies, and there we speak to thiamine deficiencies, and where we alluded to Wernicke-Korsakoff, hypercarbia, thyroid disease, both hyper and hypothyroidism, Cushing syndrome, and also exogenous corticosteroids as well, hypo and hyperthermia. Then 6 infectious causes, especially in the elderly, where sepsis or infection can manifest with delirium, right? Because they have diminished physiological reserve. Stuff like urinary tract infection, pneumonia. So it's always good to send off a urine for MCS, to send off a sputum, and also to blood cultures for these patients, so sepsis, meningitis, encephalitis, brain abscess, once again, intracranial infections, right? Other stuff like insomnia, hypertension, and PRES, which, as we know, is posterior reversible encephalopathy syndrome. So you got 8 from neurological, 4 from toxic, 11 metabolic, 6 infectious, 2 others, giving you 32 possible etiologies for delirium. Some encouragement for you this morning. You know, it's said that in life, one should never reply when you are angry, never make a promise when you are happy, and never make a decision when you are sad. The book of Mark, chapter 12, verses 30 to 31, records for us this instance where there was a teacher of the law who came and approached Jesus and asked him, which is the greatest commandment? And Jesus' reply was this: love the Lord your God with all your heart, soul, mind, and strength, And then the second one is love your neighbor as yourself. There is no commandment that is greater than these. And my purpose for living is simple: to love God and to love people. And I hope that will also be your ambition as well. Have yourselves a wonderful day. We'll catch you tomorrow with another algorithm in internal medicine. Stay well.